Hey, it's Ev, and I have a few updates on my semi-rigid rod surgery that I had done 9 days ago now. The last couple of days I've been a bit worried because the wound that I have that's on the underneath side sort of not closed as well as the one on the top. I can't actually see it, but just from what I've been told, and I was shown a picture by the nurse once, and it's just not healing as well. So I was really worried there might be like an infection or something, because with the semi-rigid rod or with the pump implant as well, I think if you get an infection, often they have to take the whole thing out and start again. But I saw the doctor today, which I had an appointment to see him anyway, and he said it's looking okay, just the wound underneath has some delayed healing. He said that the wound that I have sideways along my pubic bone, that is from the implant itself, and the one I have vertical on the underneath side, that is from where he did some like reshaping. I didn't get debulking because I don't think he took fat out or did lipo or anything like that, which is something a lot of people that have ALT then have done to decrease the girth. But from what he said, and he did talk to me about it before as well, he just pulled the skin tighter to just improve the shape, because it was a bit more like square looking around the base than the tip, which it does look a lot better now, so I'm glad that I had that done. I don't think I had to pay any extra to have that done anyway. But yeah, all of the pain and issues that I'm having now is with that scar, or I guess it's not a scar yet, it's still a wound, which is actually the like less important one and the one I need to worry about less. I think it's not as deep of a wound, and maybe that's why it hurts more as well, because it's not numb. Whereas like my pubic bone, when I first had the surgery done, it hurt so much when I first woke up, but now I actually haven't. Maybe occasionally get like the odd like sharp pain in there, but it's not that big of a deal. And I mean, the other one as well, it just feels kind of sore, like I guess if you like fall over and cut your knee, it feels more like that, which makes sense. It's more that I was just worried that it would be infected and that we'd have to reverse the whole thing, which is a risk, and I know that. I mean, it still is a risk. There's always chances of complications, and you have to know that when you're going into things like this. But yeah, as for right now, it doesn't look like that's what's happening, and I have to go in now twice a day to have my wounds cleaned, I think just because there's some delayed healing there. But she told me to come in at 10 a.m. in the morning for morning wound clean, and then to come in at 2 p.m. in the evening for evening wound clean, which 2 p.m. is not in the evening, and those are already 4 hours apart, so I'll basically be going in, coming back, and then a few hours later going back, and then coming back when having like most of the day and the whole night. I still have to keep everything propped up as well. I'll make another video about that because I found some like helpful tips and tricks for that, and that's something not a lot of people talk about. I will be seeing the doctor once more before I fly back on the 30th, I believe, from what they were saying. So I'm still thinking probably about 2 weeks post-op is when I can bend things downwards and not have everything elevated all the time, which is awkward because I only have one pair of shorts that like fits me properly without squishing me like that, so I'm having to like wash those in my sink so that they're clean as well, because that will cause infection as well. And there is a washing machine upstairs, but I can't take them off to put them in because I'm not what I'll be wearing. Yeah, overall I'm feeling good. I think yesterday I was just feeling a bit worried about things, and then in general wasn't feeling good, but still on antibiotics anyway. I still have painkillers if I need them. I finished my medication for the swelling, but I don't think I'm that swollen anymore, more so like way underneath area, but not as much as last year. Yeah, I thought I'd be able to like sit on that nice chair and like angle, set up my camera and everything, get the natural light and make some like proper nice good quality videos, but I'm basically just having to lay down in bed constantly. I don't want to be moving around too much and keep reopening this wound. Also kind of hurts to sit in a chair, which I can because I've been going for breakfast at the little cafe that there is now, and been like mingling a bit with the other trans people as well, so that's good. But yeah, sitting in a chair doesn't feel the best. It's also awkward because the wound that's like an issue is the one that I can't see. Like I can't keep an eye on it. I can't really even picture what it like I've only seen a picture of it once, so, and I can't take my bandages off to take a picture so that I can see, because I'm supposed to leave them on and let the nurses do it. But yeah, this has been a long video, so I'll leave it here, and then if you have any questions or anything, and I'll make another video about how I'm keeping everything elevated. Yeah.